As part of optimal care for our patients, we should include oral health advice as a routine part of the dental visit. Dental practitioners have a responsibility to educate parents, carers and children about the importance of caring for oral health. During this stage, it's important to avoid blaming. Explore the oral health concerns with the parent. Work with the parent to identify 1 or 2 simple strategies that are meaningful and realistically achievable. Encourage questions and offer follow-up and support.
Have a look here. Can you see the animals here? Look.
What's that? Tiger.
Can you have a look at the animals? Do you want to stand up here and look at the animals?
Yep.
Please stand up. Yeah. In terms of brushing her teeth, you can actually, I don't know if that will help you, but you can actually do it that way.
Yes.
I'm not sure how you do it. How do you actually do it?
I've tried doing it from behind, yeah, and in front, and yeah.
She just struggles like she did.
She just closes her mouth on it.
Oh,
yeah. So I can't sort of move the brush because she just bites down on it.
Just trying to think of a way to keep her mouth open. Sometimes you could use 2 brushes. You could get her to bite on one brush while you clean with the other, because that will keep her mouth slightly open.
Okay.
The other thing, look, the most important thing initially in terms of protecting her teeth is to make sure that we get some fluoride. How old is she?
She's 21 months.
21 months. So you can actually use the low fluoride toothpaste.
Yeah.
And just basically, as long as we get it in there, almost smear it. But it's a good idea if we can get the toothbrush in there to clean her teeth. The other thing that you could do is you could get her to hold the toothbrush and assist her with brushing, you know, so that she's participating, and that might help as well.
Okay, yeah.
You could do it in the bath. I don't know whether you
do
that in the bath.
Yeah.
Okay. Or you could lie her down on the couch, and put her head on your lap and try and do it that way. Or you can do it as a team, like we've done it here. Look, her teeth are fine, they're clean. Okay, so I'm not concerned about that. It's not like there's plaque everywhere. So whatever you're doing fine, but if you can improve on it or slowly sort of make it so that you can actually clean the gums and the teeth to maintain the teeth.
Okay.
I was talking about prolonged breastfeeding or bottle feeding, mainly not overnight or when the baby's asleep.
Here, the dentist takes the opportunity to provide some oral health advice to the parent regarding the patient's younger sibling.
Ferment and can start to cause decay.
Oh, okay.
Okay,
and it just gets him off to sleep again, in the middle of the night, screaming.
Look, as long as you don't allow him to suckle all night at will. So if he cries at night and you want to breastfeed him, that's fine. Breastfeed him, but then put him back to bed. Okay. What happens is sometimes people put the child in bed with them and they suckle on the breast all night, or they put the bottle in the cot with the in the cot with the baby, and the baby sucks on it all night. And sometimes they hold it in their mouth, and the milk just dribbles in the mouth and sits around the teeth and ferments, and the bacteria in the mouth then convert the lactose, which is the sugar in milk, into an acid, and then it starts the decay process.
What I do firstly is, once I've examined the child, I will show mum or dad what we're looking at, if there's a hole or a little dark spot. So I actually show them what is going wrong in the mouth. I'll actually get a mirror, point out and say, this is the problem. Then what I do is, I don't generally launch into a lecture about this is what we should do or you should do. I generally say something like, so what do you know about, kids' teeth? So I sort of get to know what they actually understand. Some may say, yeah, I know we should clean their teeth all the time and they should never eat lollies. And then you can come with correcting their beliefs. And I say something like, well, that's pretty hard. I said, I love lollies as well, and I don't have any fillings in my teeth. You can eat lollies. However, an idea might be, or the actual take-home message is the frequency of sweet things, that is how many times you have them rather than the amount. So how do you think that could work in your house? So really getting them to come up with solutions, because I don't really know their routine. I don't know, some cultures as well may have things like they drink sweet tea all the time, and for me telling them not to have sweet things would really not sit well with what they're used to doing, maybe as a cultural practice or just a family practice. So usually I'll give them a little bit of information like, well, frequency rather than amount. So how do you think that would fit in with what you do now? And if there's anything that they're doing right, I congratulate them, because I think it's hard being a parent, and I always acknowledge that, look, I didn't know these things before I was a dentist myself, so you're not born knowing, because I think you don't want parents to walk away thinking, I'm doing such a bad job with my kids, you know, they've got 5 holes in their teeth, and giving them the advice properly in really small snippets. Also choosing what's important. If there are lots of different issues, maybe sometimes targeting the one that's easiest to change initially. So there's that little victory, I've done that, which will give them the confidence to move on to bigger and more difficult things.
And not only give them the advice, I stick with the advice. For the following appointments, I repeat that. And if I give them the task, if I say to the parents, okay, try to reduce the use of the bottle, I always, the next appointment, I ask them, how did you go with that?